Before I entered the hospital, I had a sobering moment. I realized that I would be taken care of far better in a country where I hold an alien registration card than in my birthplace, America, which is ironically renowned for its prosperity, resources, and power. I felt so much disappointment, and I was incensed that I could not depend on my country ultimately to take care of me, and that profit is put before people's livelihood.
Right. And Natasha has a very interesting story relating to the American health insurance system and her experience living and studying and working in Japan. So, Natasha?
Thank you. Good afternoon.
Hi.
I'm really excited to be sharing my personal story and experience with all of you today. My name is Natasha Albury. I came because this is an opportunity to do what I can, to help the public hear the truth about other healthcare systems in the world. I'm a U.S. citizen, but I have a unique perspective and experience. Over the last decade, I have lived, studied, and worked for a total of 8 years in Japan and Taiwan. After the last 4-year stint in Japan and Taiwan, I finally returned to the U.S. last summer to start graduate school. Those 8 years in total were the longest period I've had health insurance in my life. I can't impress upon you all strongly enough the incredible difference in the quality of life between having guaranteed access to medical treatment anytime you need it for any reason and not having health insurance.
Right!
During my first week back, a bank teller asked me if there was anything that made it hard to come home. I said yes, the fear of not having national health insurance anymore.
Right. Right.
In Japan and Taiwan, I carried a health insurance card in my purse and simply presented it at any clinic, hospital, or pharmacy at any time and received treatment without delay, questions, or limitations.
Right.
I had more freedom and choice than any well-insured American can imagine. I could and did visit specialists directly as well, even without an appointment.
Wow.
Same day. Last winter, about 1 month before I was due to return to the United States, I had an unfortunate skiing accident. The next day, a doctor said that my ACL, a major knee ligament, was torn beyond repair. He strongly advised me to have reconstructive knee surgery, followed by 6 months of rigorous physical therapy to regain the function of my knee and return to full physical activity again. The doctor explained I'd be badly swollen for a while and surgery wasn't possible for 1 month. My roommate and I explained that I had now just 2 months left on my visa and was now, as of that day, unemployed, so I could not extend my visa. The doctor then advised me to return to America in a month or so and seek treatment there. He assured me I'd receive a similar operation and physical therapy, but we were scared that I'd be denied treatment because I was now seriously injured without health insurance in America. I was stuck. I could not stay long enough to use my health insurance and receive treatment in Japan, and I could not expect any health insurance company to cover me because of the pre-existing condition clause, especially for an expensive procedure with surgery, anesthesia, hospitalization, months of physical therapy, MRIs, x-rays, and follow-up visits. Many family members and friends on either side of the ocean emailed, called, and gathered information on all of the options and possibilities for my health care and recovery. In desperate times, people really show their compassion. My Japanese students and even strangers were rooting for my case and driving me all over the city to make a miracle happen. The health insurance staff at my local county office called with a detailed explanation of what my hospital bill would look like and exactly how to save myself time and expense if I could persuade immigration to let me stay.
Wow.
Honestly, I wanted to come back here and be with my father during this time, because we had just lost my mother suddenly a few months before this happened. But he told me not to take such a risk. My father and all the people who came to my side, including a Japanese friend who was attending nursing school in New York, agreed and convinced me that I was far better off begging Japanese immigration officials for a special extension rather than being at the mercy of the American healthcare system, in which I'd either be denied or desperately trying to obtain loans for approximately $50,000 for my procedure in total. I found one of the very best and well-known sports injury surgeons in my region of Japan, and he agreed to reserve a surgery date and a bed in his hospital for 1 month as soon as my leg was ready for surgery, on the condition that I could extend my visa until August. The doctor wrote a letter with his recommendation, dates of treatment, and his name stamped on the line for me to present my case. I took this letter, my own letter of explanation, and various documents from my taxes and health insurance payments. I held my breath after I handed my papers to the immigration officer. Would they grant me a special extension for medical treatment and allow me to soak up thousands of their government's yen for surgery? A few hours later, a young officer knelt by my side. He pointed to my new visa, and he said, "You may stay until August. Take good care."
Wow.
Yeah, it's hard to find that kind of humanity in a official office. So my friend Sachi and I, we were amazed. We hugged and cried with such relief and joy. I told my doctor the news, and he then proceeded to tell me I'd be in the hospital for surgery next week. Famous soccer players came to have surgery there. All the local college athletes asked for Dr. Hara when they injured their knees and ankles. From March to July, I received excellent health care and treatment and could rest easy that my health and wellness were in good hands. Before I entered the hospital, I had a sobering moment. I realized that I would be taken care of far better in a country where I hold an alien registration card than in my birthplace, America, which is ironically renowned for its prosperity, resources, and power. I felt so much disappointment, and I was incensed that I could not depend on my country ultimately to take care of me, and that profit is put before people's livelihood.
Right.
When I totaled up all of the bills after 5 months of medical care, after my insurance payments, I had paid roughly $2,000 US instead of $50,000. I am now pursuing a degree in public health promotion here in Portland. And I have a conviction that we can, like all other first world nations, ensure that everyone has access to health care. That kind of comfort and peace of mind is priceless. Thank you very much.